Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hello there, I am Dr. Callerina Woodard, and over the course of the next few videos, we're going to be talking about neck pain. So I'm a chiropractor. I am very familiar with the spine and the nervous system and posture. I've treated patients with neck pain for years. So I want to start helping others uncover more of the root cause of neck pain. And that's why I did this within 3 different videos, because one video can be way too much information for someone to handle. So I'm breaking it up into 3 separate videos so that we can go through what could be the most common root causes of pain or discomfort, tightness. We're also going to talk about mobility. We're going to talk about posture, of course. And then when it comes to not only correcting the issue, I'm really big on this. Yes, we want to get our patients out of pain. Yes, we want people to feel better, but I really care about the long term. How can this person keep these issues from coming back? So we're going to make sure we hit on all those things over these next 3 videos, and I hope you get a whole lot out of this. So this is neck pain part 1. The part 1 is going to be more about uncovering the common causes of neck tightness, pain, and headaches. And then we're going to talk a little bit about how to start resolving that issue. So neck pain is something, like I mentioned, that I see in practice, and I know a lot of other chiropractors and physical therapists do as well. We see it very commonly. It's one of those things that I believe the statistic says that over the course of a person's lifetime, 70% of people will experience some sort of neck pain, neck tightness, or neck complaint. And most people assume that it's 100% in their neck. 100% it has to be just the cervical spine. But I want to make sure we cover all of our bases and understand that the root causes could be coming from somewhere else. We may know that as practitioners, but it's extremely important that we explain that to our patients. It's not always arthritis. It's not always a bulging disc or bad genetics. The truth is, a lot of times, the neck is just a victim. The spine is just a victim to tight muscles due to poor posture, due to compensation. Like I mentioned, neck pain is more than just common. It's extremely common. Think about it that throughout your life, most people are going to experience some sort of neck pain. And that's because we spend hours on our phone. We spend hours in front of the computer. And then nowadays, our kids are even spending more time playing video games, even more time on their phone. And we're doing less things to work on proper posture because we're spending less time focusing on our posture, spending more time focusing here. So our bodies just aren't designed to stay put and stuck in one position for very long. And that's where these compensation patterns start to form. And this is typically the root cause of what we see most commonly when it comes to neck pain. There's a quote that I really like by a physical therapist that I had read before that says, okay, so the wind blows and a tree falls over. So it has to be the wind's fault, right? But no one takes a look and pays attention to the fact that a beaver has been gnawing away at that tree for years and years and years. So that's what happens in the case of a lot of our patients is for years and years and years, they're sitting in front of a computer or they're sitting at a desk for hours and upon hours a day. And then they go to look a certain way, that wind blows, and their neck is now having issues. So we need to understand that it's usually not most cases, and there are cases where it is just one big event, like a car accident or a football injury or some other kind of sports injury. But a lot of times it's this accumulation of these microtraumas that lead to this being some kind of issue with our patients. And something we see very commonly in healthcare is that pain equals that's the site of an injury, or that's the site of the issue. But we really need to understand that pain is a signal. And just like I have an illustration here of a check engine light, that's a signal. If you put something and just cover up that check engine light, just cover up the signal. I know you've probably heard that analogy before. That's not going to fix the problem. So pain doesn't always mean that something is damaged right there, at the site that you feel discomfort, but it does mean that there's some sort of dysfunction going on. A lot of cases, our necks can hurt or we can get headaches because our muscles are overloaded. It's not the pain back here because of everything pulling, our traps pulling forward. It's not this muscle's fault. This muscle's fault's being victimized by tight muscles in the front. So that's what I want to get into a little bit more. Let's understand that piece so that whenever it comes to educating our patients on that, they have a better concept and they're able to work more efficiently towards correcting their issues. So we can't not talk about physics, and most of the people that are going to be listening to this video have an understanding of chiropractic biophysics and the fact that when it comes to the weight of our head, which is roughly 10 to 12, that's a really rough range. It can be heavier, it can be slightly lighter, especially in younger, more petite people. But when it comes to our head, there is some weight to it, and it should stack directly over our shoulders. The more forward it goes, due to physics, that's going to put more stress because it's further from where it should be balanced on top of. And that puts more stress on our joints, more stress on the surrounding tissue, more traction on our spinal cord and our nerves, and eventually more breakdown and compensation from our muscles. So that's why I have seen in practice a lot, most people when they complain about neck pain, if they're not already complaining about headaches or jaw pain, they say, I get this trigger point pain right back in here. They're pointing back over their trap or right where their elevator scapula inserts. Well, that's because that is being stretched and under load a lot. We're not taking into account, usually their pecs don't bother them. Their SCMs may not bother them until you start poking on them. But these are the muscles that are pulling things more forward, impacting our neck and our shoulder mobility. I mentioned microtrauma and compensation patterns being the most common issue when it comes to pain. So as we go more forward, as we develop more muscle imbalance, we end up creating more overload, and this is what creates that signal, that check engine light, that pain to start to occur. So if we focus on just where the pain hurts, we're often going to miss the why it hurts. So, doc, if you just make this pop right here, just right between my shoulder blades, the amount of times I've heard that before. Okay, well, that's not going to fix something in the long term until we pull everything back and take away that overload so that your muscles stop compensating, so that you stop stressing out and even atrophying some muscles. The pain's not going to go away solely by making something pop. Temporary mobility and pain relief, that is a thing that most people are chasing, but we have to fix the poor posture and the muscle imbalance for the long term of our patients. And it's not just poor posture, and yes, we pick on computer work all the time, but it's also, I see it in women all the time, how you're carrying your baby, how you're feeding your newborn. I see a lot of pregnant women, postpartum women too, that are leaning forward and stuck in this posture. So educating our patients on how to balance those muscles out on top of them getting adjusted, that's what's going to help more in the long term. So we don't manage pain by chasing symptoms. That's the number one thing we're going to get out of this video. Ice packs, pain rubs, massages, massage guns, PT, and then even chiropractic adjustments don't always address the root cause. We can make things pop. We can stretch that levator scapula. We can stretch those traps. We can stretch those laps. We can stretch things, but if we're not getting to the root cause of the muscles that are taking over, the imbalance, the poor posture, the sitting for hours and hours and hours, then we're just chasing symptoms. And every profession can become a part of this. So that's why it's so important that you understand and uncover the root cause, starting with those compensation patterns that are leading to overload of the muscles. Up next, I'm going to talk more about headaches and dizziness, vision changes, and the fact that TMJ pain, temporal mandibular joint pain, is also associated with spinal, cervical, neck issues, and pain. So the reason I didn't want to throw all of this all into one video is because we need to be able to stop and digest each section. Whenever it comes to neck pain, first things first, figure out the root cause. You have to figure out, is this posture related? Is this years of microtrauma related? Or whenever we look at something on x-ray or MRI, is this something that was more acute? So whenever we can identify things like that, that's going to help us go in the best direction when it comes to treatment.